an actor, make sure that you use the 5 minutes provided properly. Start by writing down the name of the patient, his or his age on top. Next to that, please write down your presenting complaints. And again and again and again, this is a common problem. Don't skip it. We agreed on the fact that we do pitfalls. Pitfalls are something easy to be forgotten, easy to be missed, and usually fatal in the exam. And the Arabic translation for that would be khizouk or khizouks. This is our specialty, and this is why we're here. Then comes the items of the history that I do not want to forget, and those would include social history, past history, medication history, and family history. Social history, I will always recommend that you start writing down some points next to that. Whom is this patient living with? His job. Why do I take social history, Dr. Mito?
To offer help.
Thank you, ma'am. Straightforward. Then comes smoking, alcohol, and so on, driving if applicable. And finally comes the approach. Whenever you're going for such, whether you're doing MRCP or MRCPI, it is always very wise to start by proper analysis of the stem. And the stem equals whatever is mentioned about the patient, whether diarrhea or diabetes. Then comes analysis of the system involved. Case of a headache, CNS. Case of a diarrhea, we will analyze the kidneys, do you think? Anyway, moving on, differential diagnosis, and I need a proper one to reach a diagnosis. And this is absolutely chaotic, no order here, inorganized, and I mainly aim at getting a diagnosis. Then comes a proper systemic review, and we do that in order to make sure that we have everything checked. So whatever the examiner has in mind, it doesn't make any difference to me because I will be able to defend my diagnosis. Then comes the history part, the fun part where I need to offer help. And that's why I had it already written on my paper. Up there, then comes at the very end, the closure. So if you are going for an MRCP Station 2 history taking, this should be your scheme if you wish to. And if you are going for the long MRCPI, in which you take lots of history as well, I will say that or recommend that you do an examination at this stage before proceeding with a systemic review, which you can efficiently do while discussing the case or while examining the patients. So to get things in check, Dr. Mitsu, did you write down your paper?
Yes.
I hope so. Otherwise, I will know and I will kill your headphones. Are you ready to go?
Yes.
Okay, then let me set the timer for you since we're struggling with the time. And the timer is on. The mic is yours. Go.
Hello. Good morning. I'm Dr. Mitu. I'm one of the doctors in this clinic today. So you must be Miss Stewart, 25 years old.
I am.
Okay. Nice to meet you, ma'am.
Likewise.
So today we are going to discuss about some health issue. So during our discussion, I would like to have some notes. Is that okay?
Okay, sure.
So can you please describe me a bit more about your loose stool?
Well, I've been having those loose motions for the past 2 weeks, started gradually and has been progressively getting worse over time.
Okay. And is this for the first time?
Yes. Okay. Ask me a proper question.
Okay. And are you, is
this
it gradually progressive?
Any previous attacks?
Any
yes,
previous attacks?
Had similar attacks over the past 1 year, but this one by far has been the worst.
Sorry to hear that. Okay, so
thank you.
And how many time you have to open up your bowel?
3-4 times a day, and my usual habit is once.
Okay, and how about the consistency? It is totally soft liquid, or what is it?
Most of the time, yes.
Okay, and is it blood mixed ever?
Nope, I did not notice any blood.
Okay, and have you noticed that after having food, does it increases?
Yes, sometimes it does.
Okay. Which type of food? After milk or milk product?
Well, I noticed that having some pasta makes the condition worse, especially if it's spicy.
Pasta. Okay. So, what about your stool? Does it pale, greasy, and difficult to flush?
Sometimes, yes.
Okay. And have you ever wake up at night due to your symptoms?
Sometimes I do, yep.
Good to hear.
Come again?
So, okay. So,
Yes, sometimes I do wake up from sleep because of the loose motions, the diarrhea.
okay. So, regarding your diabetes, you are diabetic for how long?
Since I was 2 years of age.
Okay. Is it controlled?
Yes.
Can you mention your hemoglobin A1C, that is 3-month measure?
7.2.
Okay. So, can you please show me your medication chart?
Insulin. 2 types of insulin, and that's it.
And are you compliant with the insulin?
Yes.
Any side effect after taking this?
No.
Any recent dose changes?
No.
Okay. And do you have any over-the-counter drug?
No.
Okay. And I'm sorry to ask you this question. Actually, I ask this question to all my patients routinely. Have you ever tried any illicit drug?
No.
Okay, that's good. Okay, so I'm going to ask you some more question. That is, do you have any tummy pain?
No.
Okay, any throw up or feeling sick?
No.
Okay, and any recent weight changes?
I have lost some weight.
How many kilos? For how long?
Well, I've lost something like 3 kilograms over the past 1 month.
And is it intentional?
No.
Okay.
Let's tackle
And
the
how?
if you think we need you to step on it, go faster if possible.
Yes. And okay, how about your appetite?
Well, I do not have lots of appetite. I think my appetite is decreased, less than I'm used to.
Okay. And is there any lumps and bumps anywhere of your body?
I know there is none.
Okay. And are you getting paler day by day?
I'm not quite sure.
Okay. So, have you ever hospitalized before?
Never.
Any previous surgery or tummy surgery?
Never.
And any previous blood transfusion?
No.
Okay. Okay, that's good. So, ma'am, do you have any chest pain?
No.
Any shortness of breath?
No.
Okay. And
Don't mind the screen. Carry on.
okay. So, okay. So, do you have any previous heart attack?
Never.
Any stroke or mini stroke?
No.
Any vision problem?
No.
Okay. What about your water work?
What about it?
Okay. Is it frothy?
No.
Okay. That's good. Okay. Any pins or needle sensation of your hands and feet?
No.
Okay. So, what do you do for your living, ma'am?
I am an accountant.
Okay. And whom do you live?
Alone.
Okay. So, do you think your symptoms is affecting your daily life and job?
Very badly. Thank you.
Okay. I'm really very sorry, and I will try to help you by involving our social worker and occupational health officer. Okay. So,
Thank you.
okay. So, how about your period?
Yep. What about it?
Okay. How about your period?
Yes. What about it? Where is that question? Show me the question.
Yes. So, actually,
is it regular? Yes.
Is it regular?
Yes.
And when was the last date?
2 weeks ago.
2 weeks. Okay. And the amount?
The usual.
Okay. And do you have any birth delivery or
I
any
was never pregnant
miscarriage?
before.
Sorry.
I was never pregnant before.
Okay, okay. And have you ever tried for any oral pill?
Yes, I am maintained on OCPs.
Okay, so do you smoke?
Yes.
For how many sticks for how long?
For how long? For 3 years.
So if smoking is injurious to our health, so if you think that we
How many cigarettes?
for how long?
How many
How many?
cigarettes per day? And for how long? 3 years, 10 cigarettes a day.
Okay, so smoking is very much injurious to our health. So if you want to quit, so I can help you by regarding our smoking cessation classes. Do you drink alcohol?
Yes.
How many units per week?
3 to 4 units.
Including your weekends?
Yes.
Okay, so apart from these, do you have any weather preferences?
Yes, sometimes I do prefer to stay in the warm weather.
In the warm. Okay. Okay. Is there any joint pain? Do you have?
No.
Okay. Any oral sore? Private
Mouth sores? No.
Okay. So what is your concern?
What do I have?
Okay. So
by the way, there are like still have plenty of time left, so there must be something you have missed. Would you like to recheck your systemic review, and if there is anything else you'd like to ask about?
yes. So okay. Uh, do you have any loss of consciousness before?
Never.
So okay.
If you feel like okay, carry on. It's your
Okay.
show.
So okay. So what is your concern, Mr. Wood?
What do I have?
Okay, so after talking with you, Stuart, it seems like that you're you are having a condition that we called celiac disease. Okay, so don't bother the medical term. It's an autoimmune condition that is that means our immune system is which is supposed to work against the bug to prevent infection, but in your case, it is misdirected and it is working against your own body. Okay, so sometimes it is related with diabetes that you are having this condition. So to manage you right now, we want to do some blood test and imaging of your tummy, and we want to form a multidisciplinary team, including our gut doctor, and we can arrange another meeting to to make you updated about your test result, okay, and know and inform you about your management plan. Do you have any other concern?
No, thank you.
Okay.
Okay.
So,
anything else?
so it may be a cause of a condition, maybe as two condition, diabetes and celiac
Okay,
disease
hold on,
associated.
hold on, hold to this. Let's get the fight going. But before we start fighting, and before I kill your headphones and eat you alive, let's agree that you did your best, and I appreciate that very much. Now it's a good time for a good fight. What is your diagnosis?
Uh, my diagnosis is the case of celiac disease on the background of diabetes, type 1, type 1 diabetes.
So you're
So,
considering celiac to be on top of your list?
yes.
What else?
Okay, I didn't check the actual autonomic neuropathy. It may be a cause of diabetic neuropathy.
Autonomic neuropathy. So would you be able to tell me what is your differential diagnosis for diarrhea in diabetics?
Diarrhea and diabetes. There may be several possibilities. It may be celiac with diabetes. It may be autonomic neuropathy with diabetes. It may be
if you can, I don't know how to make your voice more clear, but if you can like come closer or change the way you interact with your mic. will be perfect
Now it
because
is
it's
clear.
oh now it's brilliant. Keep it this way.
Okay. Okay.
So,
So,
celiac 1, 2, diarrhea with diabetics. I need 5 causes.
Other causes like sometimes sorbitol that the diabetic patient use, it can cause some
3.
osmotic diarrhea. Okay. Autoimmune polyglandular syndrome, it is associated, APS.
Oh. Anything else? Okay. Do you think that this lady has HIV?
HIV, yes.
What is the
I
common
should rule out.
HIV?
Sorry.
What is the most common presentation of HIV?
The most common presentation of HIV is diarrhea, weight
No.
loss.
Weight loss. And
Weight
she's
loss.
young and fish and she's single.
Yes,
Do
I
you
should
think
rule out.
can be here? Okay. Do you think that she has cancer?
Maybe, but because there is weight loss, so I should rule out.
And how would you rule out cancer?
Though I can rule out by taking the history of clinical picture and family history. I
Thank
have
you
already
for the
excluded.
proper. Hold on. Wait. This is something we definitely need. Whenever you have such a case, let's agree first on our reflexes. This is what we always have as a reflex. Whenever you hear the word cancer, the first thing that will be in your mind would be clinical picture and
Family history.
the earliest
family
clinical picture
history.
would be. I know. I'm going to kill your headphones. Wait for it. Clinical picture. What is the earliest clinical picture of cancer?
Clinical picture of cancer is getting paler day by day.
And what do you think about low hemoglobin or iron deficiency anemia? What is the most common complication, or what is the most feared complication of anemia?
Heart failure.
Did you ask about any heart failure symptoms?
No.
Do you think this is relevant, or do you need me to kill your headphones, or you will do it your own?
I can do.
You can do it. Brilliant. So whenever comes multiple reflexes, the second reflex would be celiac. Whenever you hear the word celiac disease, the first thing that will be in your mind would be?
That is
anyone would like to help?
Pale offensive stool, difficult to flush.
Pale offensive, difficult to flush. Straightforward. One sentence. This is one more reflex. Yep. Then comes another reflex. Whenever you hear the word treatment, the first thing that you will think of would be?
Pharmacological.
My good friend, Dr. Ihab is back. I love having you around. Non-pharmacological and pharmacological, except for 1 or 2 conditions. Nonetheless, let's carry on. So what is missing in your case? Let's agree first that you did your best, and this is quite okay by me. But there is something missing that we need to address. And I didn't mention that in the very beginning, but this is an essential tip. Have 3 sets of paper. One would be for your own practice, like this case. Another one should be for your differential diagnosis. You need them separate, handy, accessible whenever you need them. And another one, and this is my favorite, it is the painful one, the kazook or the pitfalls. So let's first fix a couple of points here because those are essentially essential. The first one would be whenever there is a case of GIT, whatever the GIT condition or complaint is, the first thing that I need to rule out is
fever, travel history.
No. Cancer. So no GIT diagnosis to be made until you rule out
cancer.
Thank you. Standard pitfall MRCP style.
Yes.
The second one, whenever there is a case of GIT or fever, what should be very early in your history?
Travel history.
Thank you. Travel history. You didn't even ask me about travel.
Yes, I just missed it.
That's why it's a pitfall, and that's why it comes in our paper. Moving on. One more point in the pitfall paper. What is in common between having HIV, TB, cancer, or lymphoma? Can you guess?
Yes, it's a
What is the
package.
typical presentation of any of those?
Lump and
It's about
Loss.
diarrhea or constipation or loss of consciousness or jaundice or weight loss.
Night sweats.
Weight loss.
It can be anything because this can affect whatever system in the body, the CNS, the kidneys, the GIT, the liver, whatever. So the presentation of those can be virtually anything. And that's why they all come together in the same package. And this is your family package. Whenever you're going to the supermarket to buy something, remember that whenever you have one for the price or four for the price of one, this is your offer. If you have HIV, TB, or cancer or lymphoma in your differential, the rest are a must. Whether doesn't have to be number one or number two, but definitely on your list. Do you agree?
Yes.
Let's add one more point. One autoimmune equals
All immune.
all autoimmunes. And how many autoimmunes do you have?
Fantastic six.
Fantastic.
Habibi wa anaya. Fantastic six. And I hate paragraphs. I love numbers. Can you enumerate for me 6 common autoimmune conditions that you face in the exam?
Yeah. Yes. Addison,
Agree?
thyroid,
Thank you.
hematological,
Okay.
then anemia, that is pernicious anemia, celiac,
Okay.
diabetes.
Take a look at the screen. Addison, how would you rule out in any case?
Addison, standing DG when
Getting dizzy on standing from a seated position, aka
Yes.
postural hypotension. Agree. What else?
hunger pain,
Which is a sign of?
hypoglycemia.
Thank you. Thyroid in a premenopausal female. Standard MRCP. How would you put it out?
Female
By
history.
female history.
Thank you. It is not weather preference. It is
Menstrual
not
history.
changes. Yes, female history. And rheumatology. What are the screening questions for any rheumatological condition?
Joint
Most
pain, skin
either
rash.
affect the skin. By the way, did you ask me about any skin rash?
No, I
Did
just
you ask me about my urine and my kidneys? No.
no.
Bad. Bad. You need to kill your headphones. Or not. Get better. So, skin rash on sun exposure, joint pain, kidneys. Any problem with your urine? Is it frothy? Celiac disease. The screening question would be, what is the immediate reflex of celiac?
Pale offensive,
Pale offensive
difficult
food.
flush stool.
Thank you. And if there is no change in the bowel habits, and this can happen, your screening question would be?
Weight
Is it
loss.
related
Why?
to specific type of food like pasta?
Misleading. This is another khizuk, another pitfall. It is never, ever related to whatever kind of food in the exam. And
Unexplained iron
already,
deficiency anemia.
it can be, but the point is, being malabsorptive condition, this patient is more likely to lose weight regardless of a certain nutrient deficiency. Keep that in mind. Type 1 diabetes, premenopausal or early loss of menstruation. Then comes pernicious anemia, and you'd expect to find some sort of B12 deficiency symptom or sign. Agree?
Yes.
This is a lot to take in. Not really. Just simple points in the pitfall, and they apply to a lot of cases. Let's make things even easier. The first step in the analysis of this condition will be analysis of the stem, which is the diarrhea and the diabetes.
Diabetes
Agree?
mellitus.
Any symptom analysis, how many points do you have for this analysis?
8.
Thank you. Previous. And this is one killer in this case. I've been having this condition for the past 2 weeks without having any previous history. This is not acute. This is chronic. Completely different story. So make sure that you do not forget it. Onset, course, duration, exacerbating and relieving, association, and timing. How many questions do you have for the timing?
Any diurnal variation, any sleep problem, awaken from sleep.
It awakens the patient from sleep. And
Yeah.
by doing so, you are efficiently ruling out functional disorders like IPS. Right?
IBS. Yes.
Right. Diabetes. How would you do analysis of diabetes, hypertension, or any chronic disease?
4
How
question.
many steps? Thank you. 4 points. And those would be?
Duration, control, medication,
Brilliant. And
complication.
thank you. And for any medication, how many questions do you have for the medication history?
3 question.
Which are?
Which are you compliant with it or not? Any side effect?
Show me your
Show me
medication.
your medication list.
Oh, okay. I'm sorry. Show me the list. Any over-the-counter drug and illicit drug.
Thank you. And if I tell you that I'm maintained on any medication like insulin, what should be the questions to come? What should be the questions?
Are you compliant with this drug? Then any side effect? And
Especially?
any recent dose?
Especially?
Especially hypoglycemia. Yes.
Which is related to Addison, maybe or not. And finally, if there is any recent change in
dose,
which is a common finding in the exam as a diagnosis. So this is proper analysis of the STEM, and we did it. The second step should be proper analysis of the GIT. Did you finish the whole GIT?
No.
And is that important? Yes. What do we get? Yes. What is the benefit of saying that? That we still need you to do some more effort when it comes to systemic review, which is very common problem for most of us. So it is not only your problem, it is the problem of a lot of us, especially some poor memory guy like myself. So don't be upset, just do some more effort to get it done right. Then comes the differential diagnosis. Do you have a differential diagnosis for diarrhea?
Yes, I think it's a case of DM with autonomic neuropathy, DM with celiac, diabetes, ketoacidosis, or sorbitol.
Okay, let me put this in more simple terms. This is your brain, and it's a brilliant brain. You have lots of information there, but those are very complicated. We need to extract them in the form of points 1, 2, 3 to make life easier. Can we do that? Let's try. So diarrhea can be either acute versus
chronic.
And chronic can be either
bloody, non-bloody.
Thank you. Which is more common in the exam, do you think?
I think bloody.
Non-bloody. Your case.
Okay.
So what would be your first differential for non-bloody diarrhea? And before you answer, take a deep breath in. Otherwise, I will literally kill you.
Cancer.
Thank you. The second differential can be something like?
Celiac.
Then comes, what else can you expect as a khazuk?
Microscopic
colitis.
Colitis. Then comes, if there is nothing related to the GIT itself, let's go systemic. And whenever you go systemic, always go red. The R stands for either rheumatology or renal. The E goes for, or stands for endocrine. And the D stands for drugs. So what are the rheumatological conditions that can precipitate diarrhea? Can you tell me 99 rheumatological conditions precipitate diarrhea?
Systemic sclerosis.
Okay, that's number 1 out of 99. Carry on.
Education. Non-steroidal.
Any rheumatological condition can precipitate diarrhea. Why? Seronegative enteropathies or seropositive enteropathies. But being the most common one, I would mention systemic sclerosis. But keep in mind that this is not the only one. Agree?
Agree.
Endocrinal causes of diarrhea.
Hyperthyroidism.
Hyperthyroidism.
Agree. What else?
Diabetes.
Addison, diabetes.
Addison.
Okay. Everybody remembers that, which is nice. Diabetes. What else? I'm waiting for the khazuk. Where is the khazuk?
Diarrhea. Okay.
Maybe yes, maybe not.
chromocytoma.
Yep, maybe yes, maybe not. Hyperthyroidism, checked. Addison, checked. Diabetes, differential diagnosis for diarrhea and diabetics in general would be one, autoimmune
Viboma.
lipoma. Come again?
Autonomic.
Autonomic
The
neuropathy.
diabetes and the diarrhea, autonomic is one. Two would be associated autoimmune. Three
Drug
would be something
induced.
like drugs,
Drug-induced.
artificial sugar, and finally, bacterial overgrowth.
Overgrowth.
Bacterial
So
overgrowth.
that in mind, this is very famous and beloved. You have it now. Carcinoid. What is the magical word for carcinoids?
Episodic.
Episodic. Brilliant. What does it mean? In between, the patient is absolutely free. Fio. What is the magical word for fio?
Episodic.
Thank you. Here it comes. So you have two essentially episodic conditions. In between episodes, the patient is absolutely free. So did we miss anything in the endocrine? I don't think so. Endocrine is done. Drugs. What are the drugs that can precipitate diarrhea? I need you to tell me 1,900 causes. I know metformin, but I want 1,000 causes. Go.
Metformin.
Antibiotics.
Agree.
Antibiotics.
What else? Still
Proton
very long
pump
list to go.
Steroid.
Beta-agonist, theophylline, illicit drugs.
Digestion.
Laxatives can cause.
Agree. So carry on.
Anesthesia.
Let's need 1,000. Every single drug out there can precipitate diarrhea. But we need the ones that we usually see in the exam. What do you think that the zoo are going to be?
Metformin.
Antibiotics. Thyroxine.
Here
EPA.
comes another tip for my
Musculitis.
my
Steroid.
full memory. I would consider that tremors, diarrhea, and palpitations have something in common when it comes to endocrine and when it comes to drugs. Few hyperthyroidism are common. Drugs, something like two conditions or two medications to treat COPD, which are
Beta-agonist.
and thiopylline and thyroxine. Someone mentioned that earlier, which is brilliant. And my favorite would be, don't forget those. Add whatever you want to add. Essentially, everything can precipitate diarrhea. So now we have a proper differential.
Uncle.
Sorry?
Colchicine.
Not sure.
Colchicine.
Colchicine, of course, any medication, any drug. So let's put everybody on mute for the time being, and only Dr. Mitu would be back. So the first step, unmute yourself, Dr. Mitu. The first step would be analysis of the stem, and we know how to do it, whatever the stem is. 2, system involved. We know how to do it properly. 3, differential diagnosis. You have a huge list. But before the differential diagnosis, I will consider first asking about or ruling out.
Cancer.
And I need to ask about
Travel.
pitfall paper. Then I will get the rest of my differential to get a diagnosis. By doing so, you can tell that medication history, family history, past history, and travel history are all part of my differential, not as part of systemic review. So I'm showing the examiner that I have those in mind because I consider them as part of my differential, not because I'm just filling in the blank. Agree? Filling in the blanks. This is the difference between the full mark and not very much the full mark. Agree?
Yes.
Then comes the history to offer help, and finally there is a closure. So the real question comes in your case, what is your diagnosis? Can anybody guess?
I don't care.
Thank you. Why? Because whatever the diagnosis is, I'm going to get it because I have a proper list in mind. Do you agree?
Yes, sir.
Did you have fun?
Yes, but actually, how I can overcome this problem? I know the question, but when I do the station, actually,
Okay, very
I don't
simple.
find out the question in my brain, actually.
Exactly. This is lack of practice, and you can definitely do better. You have it already in your brain. Just spell it out. Just speak it up, or however they describe it. Just speak, practice,
Okay.
and you'll be just fine. Most importantly is to have fun along the way.
Yes.
That's all. So brilliant. Thank you so much. I really appreciate your effort.
Thank
If you have
you,
any
sir.
question
Thank
yourself, shoot it. If anyone has any other question, shoot it.
دكتور محمد
I disagree.
الو
لا انا بعترض عادي. I'm just objecting for no reason. Just saying. اتفضلي. Yeah, sure. Carry on.
when the patient is asking me what I have, what can I say?
Okay, what would be your top differential for whatever case? If you want to do something like
يعني I will tell him this.
You're suspecting cancer. So closure-wise, as usual, 6 steps because we hate paragraphs. And not, of course, forgetting the beautiful golden points. If you need an admission, if you need the patient to start or to stop something, and if it's appropriate to provide the painkiller. So you will start by mentioning his presenting symptom, then the most likely diagnosis, which we may require you to define it, and you will form an MDT, which will run investigations, blood testing, imaging, with or without the camera tests. And finally, we'll arrange for another meeting to discuss the results and the plan of management. Let's take an example. What if I consider celiac to be on top of my differential? And I'm asking you, what do I have? What should be your answer? Try it.
You have a condition called celiac disease. It's a condition
most likely
autoimmune disease. The most likely cause.
Yep. تفضلي كملي. Yep, carry on.
Autoimmune disease. It means that this defense system is misdirected against our body. For this, we need to form multidisciplinary team and to run blood tests and MX, and we will have another meeting to discuss
with or without
results.
A camera test, and we'll discuss that in the next meeting. And anything from the golden points that you need to advise the patient not to do or to eat.
Meanwhile, you need to stop gluten.
Yep. Easy. And you can do this effectively under 30 seconds. And this is always the point of having a proper timing. Let's try another example. What if I'm considering cancer versus HIV? Can you try? Anyone else would like to try? 30 seconds. What do I have? Hello? Anyone? Nobody? My God.
I will try.
Oh.
Okay. Mr. Stewart. It's one of my differentials that some serious disease I need to consider as that maybe it's cancer. Also, another possibility is there. It could be also another infection, what we call human immunodeficiency virus. That is why we need to form a multidisciplinary team. They will request blood test, maybe camera test for you, and we will held another meeting to discuss this result.
Brilliant.
Meanwhile, we need to admit you, maybe for if he's serious.
Depending on the presentation, but nonetheless, on the principle. Allah yaftah عليك. So this is how to close whatever case and how to deal with whatever differential. This is the point. Brilliant. Thank you so much. Any other question, anyone? Dr. Mitu, I have to ask you a question.
Yes, sir.
Do you still like me? I do like you too. Thank you. Okay. So it was fun. Thank you, guys. This is
thank you, sir.
Thank you. It was in a recent diet and somewhere in the globe, but now we are able to do it. So thank you. Stay safe, stay happy, and tomorrow we'll have another
Thank
meeting.
you, sir. Jazakallah khair. Assalamu alaikum.
Thank you, sir. Alaikum salam.
Thank you, Dr.
Have a good one.
Hassan.
Thank you, Doctor.
Thank you.